Hey everybody, thanks for tuning into Module 3 on Rhythm, part of our EKG Fundamentals series. Learning objectives for this module: number 1, you're going to be able to utilize the EKG strip to determine rhythm, and number 2, you're going to be able to describe whether the rhythm is regular, irregular, sinus, junctional, or ventricular. And we'll talk about what all of that means. So just as a warm-up, why don't you go ahead, pause the video, and try to identify the rate of this EKG. Alright, right off the bat you would notice that I did not give you the full EKG strip, making it difficult to use one of the methods, the ×6 method we discussed in the last video. So what you'll have to do is count up the boxes between two consecutive QRS complexes and then take 300 and divide by that value. In order to do this, I'm going to look at these two QRS complexes. It helps a lot when the R wave lines up with one of the big box red lines. Unfortunately, it doesn't here, but we'll just try to eyeball how many big boxes are between these two QRS complexes. So I'm going to say there's 1, 2, 3, and just about 4. So if you look at the method, if you memorize the pattern, that turns out to be 300, 150, 100, and 75 beats per minute, or just take 300 divide by 4, ends up being 75. Alright, since we're already on the slide, let's talk about its rhythm. So when discussing the rhythm of an EKG, there's two things you want to keep in mind. Number 1, what is its origin? Meaning, what is the source of each of the QRS complexes? Is it a sinus rhythm? Meaning it's starting at the SA node as most normal hearts do? Is it a junctional rhythm? Meaning it's starting at the AV junction or around the AV junction? Or is it a ventricular or idioventricular rhythm? Meaning it's starting at or within the ventricles? There are several other origins that can result in different rhythms of the heart, but these are the three main ones you'll encounter and the three main ones we're going to focus on in this video. Alright, the second thing you want to think about is the regularity. Is the rhythm, number 1, regular? Meaning, is it occurring at a regular pattern? Or is it irregular? Meaning, there really isn't any regularity to its pattern, or there is no pattern at all. Let's try to use these two concepts for this particular EKG. We want to know the origin of this rhythm. Is it sinus rhythm? And what does that mean? So for this rhythm to be sinus, you need two things. Number 1, you need a P before every QRS complex. And number 2, you need a QRS complex after every P wave. So let's see if we have that here. I'm going to use arrows to point out the P waves. And you'll notice that there is a P wave before every QRS complex, which I'm going to circle here. So we have P waves before every QRS, and we have QRSs following every P. We can confidently say this rhythm is sinus. Alright, number 2, is this rhythm regular? And for this, you really want to look at the RR intervals, or the distance between two R waves. If you eyeball it, you will notice that the RR interval is generally the same, and generally about 4 boxes. Because this is consistent throughout the strip, we can say this rhythm is regular. So we're going to call this normal sinus rhythm. Normal meaning that the rhythm is regular, and sinus meaning that the origin of each beat is the SA node. Okay, go ahead, pause the video and give this one a shot. Okay, so if you went ahead and calculated the rate out, you'd get about 42 beats per minute. Let's try to focus on the rhythm now. So remember that there are two things you want to think about. Number 1, the origin, and number 2, the regularity. What would you say the origin here is? Well, we do have P waves before every QRS complex, and we have QRS complexes after every P wave. Therefore, we can say this is a sinus rhythm. You'll also notice that the RR interval is generally the same distance throughout the EKG strip, making this a regular rhythm. So ultimately, what we would call this is sinus bradycardia. Bradycardia meaning a heart rate less than 60 beats per minute. Okay, take a moment, pause the video, and try to determine the rhythm in this EKG strip. So you may have had some trouble identifying the rhythm in this case because, well, there's no P waves at all. And because we don't have P waves, we know for sure that this is probably not a sinus rhythm. To understand this rhythm strip, let's go back and review the normal conducting system of the heart. This starts at the SA node, goes down to the AV node, down the bundle of His to the left and right bundle branches, eventually to the ventricles. And we said most of the time the rhythm can be sinus, it could be junctional starting at the AV node, or it can start at the ventricles. The lack of P waves have essentially ruled out sinus as a possible culprit. So it's either going to be a junctional rhythm or a ventricular rhythm in this specific case. So how do we tell the difference? Well, number one, you want to think about the rate. You may recall from your physiology class that as you go down the electrical conducting system, the innate rate of firing at each level decreases. So the SA node normally fires between 60 and 100 beats per minute. The AV node normally fires between 40 and 60 beats per minute. And the ventricles typically fire between 20 and 40 beats per minute. If you calculate the rate out of this EKG strip, you get about 60 beats per minute, which is consistent with a junctional rhythm. The second thing you want to look at is the QRS complex. Now I know we haven't had our intervals lecture yet, but based on the EKGs you've seen so far, I'm sure you would agree that this QRS complex looks pretty consistent to most of the ones we've already seen. They don't look too wide and they don't look too abnormal at all. Generally, a wide QRS complex is larger than 3 little boxes. In this case, it's less than 3 little boxes, and this is normal, or what we would call a narrow QRS complex. This also points us to a junctional rhythm. So why is a narrow QRS complex consistent with a junctional rhythm as opposed to a ventricular rhythm? When rhythms start in the SA or AV node, they go down the bundle of His and depolarize the left and right bundle branches at the same time, resulting in synchronized depolarization of the left and right ventricles. If the rhythm started in some point within the ventricle, then clearly one ventricle would depolarize before the other, resulting in depolarization occurring in a dysynchronized fashion. This would result in a wide complex. So the general rule of thumb I want you guys to remember is sinus and junctional rhythms are usually narrow complexes, while ventricular rhythms are usually wide complexes. There are always exceptions to this rule, and very important exceptions, but at this point, I just want you to remember that rule of thumb. Finally, if you eyeball the distance between each R wave, you'll notice that this rhythm is occurring at a pretty regular fashion. Okay, take a moment and try this EKG out. Once again, if you try to identify the origin, you will notice that there are no P waves before every QRS complex. So we know for a fact that this is not a sinus rhythm. So it's either going to be a junctional rhythm starting at the AV node again, or a ventricular rhythm starting at the ventricles. Think about what we talked about in this last slide. So to differentiate between the two, you really want to think about the rate as well as the type of QRS complex we have. We can really look at any of these leads, but I think the precordial leads give it away pretty well. For example, look at V1 here. These QRS complexes are definitely wide. They're wider than 3 little boxes, which is our cutoff for normal. You see the same thing in V2 and V3. And you would really see it in any of these leads if you look close enough. So we know that this is a wide complex. So the lack of P waves and the wide QRS complex points us to a diagnosis of a ventricular origin for the rhythm, or what we would call idioventricular rhythm. But that's not all to the story. Let's try to calculate the rate out and see what we get. We would get 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 times 6, which equals 54 beats per minute. So this is a little bit above the cutoff firing rate for a ventricular rhythm. So this is actually a idioventricular rhythm going a little bit faster than normal, most likely as a result of the autonomic nervous system kicking in. So we would call this an accelerated idioventricular rhythm. And again, if you eyeball the R waves, you'll notice that this rhythm is pretty regular, occurring at a pretty regular pattern. Alright, take a moment and try this one out. So we've seen this EKG before. This is our EKG of atrial fibrillation. One of the hallmark features of atrial fibrillation is the lack of normal P waves. So you really won't see P waves in this specific EKG. We know just from that this rhythm is not sinus. So is this junctional or ventricular? Well, let's look at the pattern that the QRS complexes are occurring at. The RR interval, or the distance between each R wave, varies quite significantly, and this is pretty consistent with atrial fibrillation. So we would call this an irregular rhythm. Irregular rhythms are not consistent with sinus, junctional, or idioventricular rhythms. These QRS complexes are more likely a result of abnormal signaling starting somewhere else, most likely within or around the atria. This is a classic appearance for atrial fibrillation, an irregular rhythm with no P waves. Okay, so we actually went through a lot in this video. A few takeaways. So when describing rhythm, think of two things: the regularity and also the origin of the QRS complex. We talked about how to differentiate sinus from junctional from ventricular. We also discussed that regularity is dependent on the RR intervals. And finally, we know the origins of the rhythm can be determined by the relationship between the P wave and the QRS complexes, as well as the characteristic of the QRS complex. That's about it for this video. I'll see you guys on the next one on Axis.